Advancing health equity is a key priority for the American Hospital Association and the American Medical Association. Both organizations have many initiatives and programs underway to support these efforts. But this work is challenging on many fronts. Welcome to Advancing Health, the podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. This podcast features a conversation between the AHA's Joy Lewis, Senior Vice President of Health Equity Strategies and Executive Director of the Institute for Diversity and Health Equity, and Dr. Aletha Maybank, Senior Vice President and Chief Health Equity Officer for the American Medical Association. Hear them discuss some of the top challenges and opportunities for advancing this pivotal work. And now, let's turn it over to Joy.
Is it fine to call you Aletha?
That is fine.
Okay.
Absolutely.
It's such a pleasure to have you here with me today. I've literally been waiting for this conversation for quite some time. And then you penned this piece we're going to talk about that was published in the New England Journal of Medicine in March, I think it was. And that accelerated our conversation today. But thank you for joining me. And just for our audience, a little bit about your career that has spanned quite a few inaugural leadership roles, including the role you currently occupy as the Chief Health Equity Officer of the American Medical Association. You were also the founding Deputy Commissioner for the Center for Health Equity at New York City Department of Health and Mental Hygiene, and the founding director at the Office of Minority Health in the Suffolk County Department of Health Services. You've taught medical and public health students on constructs related to health inequities, topics such as public health leadership and management, physician advocacy. I know that's a real area of emphasis for you, and community organizing in health. Maybe we can start by looking at, given your background and experience in DEI and health equity, you, like many of us, are really in a tough position right now. Our nation is seeing significant backlash towards DEI efforts across the board, frankly. And as I mentioned, you took pen to paper and you wrote a piece entitled The Plight of DEI Leaders, Heavy Expectations and Limited Protection. And in that piece, you shared quite a bit about your personal experiences, about the attacks, the criticisms you're facing as a leader in this space. So let's start with something a bit closer in and a little more personal about how are you feeling and how are you coping with the demands of your role and the broader political environment within which we find ourselves, and maybe touch a little bit on why now? Why did you choose to write this piece at this particular time?
Sure. Thanks, Joy, for having me on. Great to be in conversation and share space with you all the time, because I think that's an important part of how we cope, truthfully, to be in community with one another sometimes. And it helps support our own kind of experience to have shared validity of what we are going through. In this environment, though, there's so much, and there's so many constant reminders of how people don't fully value other people. And for all these reasons that, I just sometimes, I could say, of course, I understand some historical nature and context and stories that people have been told. But, when you're not rooted in that way, and I wasn't raised in that way, and it's still just so hard to want to even understand, especially when people are harmed. And the context of people being harmed should be appalling for all of us, but it's not. That just becomes exhausting. And you may have heard me say before, I feel now, especially at this point in my career, I didn't feel it as much earlier, but I'm paid to convince people to care about the humanity of others. Is really my overarching role, because that's at the core of it. If we all actually valued each other, and even in not understanding each other, knowing we don't know what we don't know. So a lot of my work is really creating those kind of environments of which that happens. Like, I believe in the context of proximity, and that in order to actually get to that space of seeing and understanding, being proximate to someone, Brian Stevenson talks about that. Many people have talked about that. I think about, again, how I was raised by my mother. She, grew up poor in another country, but ended up having a decent amount of privilege here because of the work she put in her. She's a smart, brilliant person, so was able to create a lot for me. I did not grow up in the way that she did, and she recognized that and said, I can't have this false, I don't know if it's a false sense, but I need to have a more global sense of the realities of others. And so she would place me into people's homes
Ah,
that did not have what we have, and so I learned a lot about that and as a context growing up. But that's important in the work that we do. We talk a lot about the data pieces, which are important in terms of accountability and seeing change over time. But I don't feel that that's the point of which people actually change their will and want to do better and be better and lead better. And so that's why I come back to, I feel like a large part of my role is convincing people to see the humanity and to care about others in ways that are different than their own self-interest. And I wrote that piece, in all honesty, because I was feeling a lot of pressure from within institution, outside of institution,
mm.
not really being, not knowing if people really see the complexity of the experience. And I knew just based on what was happening already in kind of the news stream, folks like you who I was in conversation with. And so I wanted to create this space where I was going to kind of speak to it. The first iteration of this was actually a love letter. And it was a
Ah, that's
love letter
interesting.
to,
To
it was
yourself.
much longer. Yeah, it was, no, a love letter to DEI colleagues across the country. It was a
Okay.
different frame. It was a little bit more, and it started off more so kind of, I see you, I feel you, and it was more directed towards, the leaders themselves. Now there's a secondary piece of that to how it turned out to be. One, I had to condense it because it's where it ended up being published. So I wrote it because I felt the desire, the one, to be in like solidarity with many of us doing this work. I wanted y'all to be seen and heard in a way that typically people are not talking about it and people aren't asking us really how it is. There are a lot of assumptions being made.
Wow. There's so much there, so much to unpack, starting from even your land of origin, at least in terms of your mom's history and where she's from. And I actually come from a very similar experience as being born and raised in Jamaica, where being black is actually celebrated, right? The vast majority of Jamaicans look like me, and that when you're the predominant culture, and granted, there's Jamaican white Jamaicans, Indian Jamaicans, Chinese Jamaicans, but the motto there, the Jamaican motto is "Out of many, one people." So everyone actually sees themselves first as Jamaican. It was shocking when I, at 14 years old, came to Brooklyn, and granted, there's quite a Caribbean community there, but quickly I started to realize it's a different game. It's a different way in which the dominant culture relates to Black Americans.
When you see yourself as presidents, doctors, all these things,
Correct.
there's nothing telling you you can't be or can't do, right? But when you get to an American society, no matter, even if you're in a predominantly Black community or neighborhood, the structures and the systems and all these institutions that we work with, the work that we are doing continually tells us we're not present, we're not seen, or we're there in limited numbers.
Well, thanks for carving out some time. It sounds like it was cathartic for you to actually write this piece, and it's been well received by those of us in this space, working alongside you and others. So in the article you mentioned that DEI leaders cannot be held accountable for their institution's decisions, right? Specifically, but higher DEI leaders cannot be held personally accountable for their institution's decisions. We are being scapegoated for our institution's decisions, while we have no power to make these decisions on our institution's behalf. So, can you provide a little more insight? And what were you thinking as you were reflecting on being scapegoated What in fact should DEI leaders be responsible for? Because it's certainly a mixed bag out there. And if you can share with our listeners a little bit more about your vision for our role to work behind the scenes where we're really trying to change people's hearts and minds, which is a tall order.
It's a very tall order, but and because all these are very personal, because it's all about value. It's all about how we value people.
Correct.
So what I meant at that moment, I was getting a lot of, the hardest part is when you feel like you're misunderstood. And when you work in an institution like the ones we work in, there are a lot of assumptions, unless you know me personally, and you know how I show up and you know my level of courage and my level of, being very direct. And I am not my institution. I am Aletha Maybank, who is a
Right.
hired chief health equity officer. Do I have influence at certain points? Absolutely. But I am not over the power of my institution. My institution has a board, it has a House of Delegates, there's an executive vice president.
Mhm.
I'm supporting and working on behalf of these members and responding to policy that's passed. I don't create policy, I don't create statements or positions. And to get held accountable for it, and that's what was happening, and it is happening, was really hard because whether I align with positions or not, it's not my decision. And as an individual, it's really hard to take on the burden of an institution that's been around for over 175 years plus. I will be held accountable for the work that I'm to do. And my work was to facilitate a process to begin to embed equity into the entirety of the enterprise of the American Medical Association. And that has been my work really in my former roles as well. And so following that roadmap, that usually means I need to create a strategic plan of some sort and create a team that can help do that, but also work with others across the entire enterprise. It's not just about me and my team, it's about also how I manage up and how I manage across and how I work with colleagues. That's the nature of my work. How will I facilitate this process and help support creating and contributing to the culture, the policies, and the practices within the institution and how we measure them, right?
Point. For you, it's 175 years. For me, we just celebrated 125 years last year. I mean, there's legacy thinking. There are structures in place that support the fact that we've been around this long, right? And so it is certainly a challenge. And for those who think we're not being disruptive enough, right? It's just it's hard to hear that.
It is hard. Mhm. And I think in the article, I made sure I also like every word because I want to acknowledge the role and the critical nature of our external organizing. That is paramount,
Correct.
is absolutely paramount. We have changed and movements happen, structure have changed because of the organizing that happens locally in our communities, nationally on a consistent day-to-day basis, the shoulders that we stand on. And because these institutions were not set up for us or by us, and most people who have been historically marginalized or colonized, we have to stop some level of the bleeding because these institutions weren't set up. They were harming us. And so we need to be here on this inside. And this is a hard part of the work, truthfully. I don't feel this is a healthy work to doing equity work on the in. That's what I've learned at this point in my career. Am I not saying I'm not saying it's not necessary, but I'm also clear it's also not fully healthy.
I think I've also heard you say just in our conversations, here and there, that you actually look forward to a day where our roles would not need to exist.
Yeah, that's with anything. And we aren't new to these roles, right? Roles probably came around in the 60s as civil rights, and then they started to hire the firsts of everything, first blacks of everything to be in these institutions, maybe a little bit before that. But then you start to see the evolution and you have these laws and structures are passed. Somebody had to do the work of ensuring equal opportunity and access that is afforded to us, through civil rights law. But nobody ever really fully thought about the harm that's caused by all this. I think it was a good thing at one level, but these roles haven't fully evolved to a level of understanding and structure that more has to be in place to protect the individuals and those who are doing this work within the institution.
So, leaning into that a little bit more, how can these institutions protect us and help us feel safe when there's this noise all around?
Right. Provide a couple examples, and I'll start first with kind of, the frameworks that are used. And I believe we should have frameworks that we use or plans, whatever you want to say, that are built on some previous models that have existed. And so in our strategic plan, and I mentioned, that we've used the Government Alliance for Racial Equity that's been in evolution and development for over 20 plus years, as a foundation, just so that there's a level of consistency around a communication. Staff are able to understand and buy into it. The part that has always been missing is the trauma informed piece to it. And so I do believe, and so we added that kind of around it. I would say California Department of Health has probably done some of the best work around ensuring that when they implement models of equity and frameworks within their institution, they're also building in trauma informed systems and supports, and ensuring that there's training from across as it relates to trauma informed support, so that safety. And I don't want to say, I think these institutions become more safe. I don't want
Right,
there's no ultimate safe within
right.
a context of these institutions.
It's a continuum, right?
Yeah, and I think
Yeah.
we can create safer environments where people feel more included and they can show up as themselves and be themselves, and be responsive. So that's one thing. I think the other critical nature is top level leadership. If top level leadership is not on board with any of this, I don't see a point in doing any of this work. Period.
Couldn't agree more.
It doesn't work. I think the ability to that leadership then to create spaces or to allow their teams to have space and to develop space and to inform some level of what is happening in terms of culture at the institution is absolutely critical also, because again you're getting ideas again from the folks who are most proximate to the experience of what it means to be an employee. It's different. Like, my experience is way different than other staff members. Like, I understand where I'm positioned. I am at a position of power to some level, and a large level, truthfully, compared to most team members. Now, I'm not saying I have, as I've mentioned, I'm very clear about my limits. Very clear.
But there's influence that you can certainly wield.
Absolutely. And so we have to do all that. But that's important, the leadership showing up and creating that space, having that consistency, communicating around it as well, not making assumptions that people know what it is. You have to have the comms plan.
And you have to be redundant in your
That's right.
communication around it.
That's right.
Yeah.
And so those are the things for safe. So that's kind of at the organizational space. Now, for us who are doing, more specifically for us who's doing this work, because that's all helpful for our work, right? That's all helpful for how we were able to lead in this work. How the employees are helps us, right? Because who do people come to, when there are problems? I'm sure you have heard many things that aren't particularly job related to the role of, chief health equity officers to some level, but you've heard, I'm sure, many complaints because you become the safe person that folks want to come to. And if
Right,
the
right.
institution is not showing up, the systems aren't working for staff, they're going to come to us, and that burns us out. We have to hear all these stories and we don't know even what to do with them half the time.
No, you're spot on. Yeah. So you need the environment to be ripe to do this work and to be supporting the work and to be supportive of the leaders who are occupying these roles.
It's the context of physician burnout, right? Like, if you think
Exactly.
about it in that way, right, it's the same thing. System structures, culture doesn't work for patients. It's not going to work for physicians, right, or other healthcare workers and providers. They're going to burn out. But the one other thing that I'll say in terms of protections is, now in light of getting death threats, and I know several of us have been in this space, I think there has to be the responsiveness and ability for our own kind of HR, security department, whatever it is,
Mhm.
that if we need security detail, we need safety plans, that needs to be provided as well.
That's right. So down to the very granular tactical, like,
Yeah.
yes, some folks may need protection outside of the workforce, outside of the workplace.
Absolutely.
So, one of the things I think I struggle with is not having folks show up for us, right? So, having to be that person at the table who consistently raises the equity considerations into whatever the conversation is that we're having. And, I guess some of our critics would say that's a failure of on our part to embed equity into whatever the organization's doing. You and I know that is not, again, the system is designed to produce the results it's producing. So, how do you get colleagues to be more than allies, but to actually own some of this work in a way that's meaningful and impactful to move the needle? What guidance would you offer up in terms of taking actions and not waiting for the perfect evidence to act?
Well, there's two questions in that, but the first, this is where top level leadership is critical. And because I've been to several different institutions with different types of leadership, I understand the critical nature of when you have a leader that really holds your own colleagues accountable. I've been in situations where I didn't have to do that, wasn't my role. My role was to establish the framework and the process to embed equity, not have to actually hold the accountability of my colleagues. And some of that is done now, but the challenge, if that's not done at the leadership level, the reality is not everybody wants to do this work. That's just real, right? So we have to accept that. So if we really are committed as an institution, then it's going to require somebody other than me, who's the boss of other folks, to hold people accountable. The other part of it, what I've found is the better my relationship is with, and I'm talking about individual colleagues, the more likely they are to show up with me. Now, some people are going to do that naturally, like they're just going to do that. And I've had that. I've had that where I am, I've had that before. But I realize the more tense my relationship is with somebody, the more resistance it is, the harder it is to get them. And so there's a part of me, and it's hard because I have to care about the entirety of the institution. But there's a part of me that at this point, I'm exhausted. And so I'm going to go to naturally the folks who are ready and willing and just going to show up and step up, because that's where my energy, that's what I can handle right now. It's hard to continually fight folks, and not like, it might not feel like a literal fight, but to constantly push up against resistance that can show up in so many different ways. And that's the other part of it that folks don't realize it. Like, people can resist with a smile on their face, and the decisions and what you get blocked out of, and it's very isolating, as I know many of us have experienced. And you just you just get to a point where you almost sometimes question, like, why are we doing this work? Why? I understand the why, but there's an element of like, why? Like, there's just, it feels just so harmful and so frustrating, but you have to then remember that there were harder fight people who were fighting harder fights than we are. And so that's kind of the obligation to it, and also the hope of it, right? Because we know that their work and efforts did help things get better from the inside and outside. And so we are here, just as you said, continuing that legacy with the same hope that what we put forward is going to help people overall, everybody, not just even a singular group of people, but it's going to help everybody, because it's going to help our society, it's going to help culture, and it's going to help the human condition and way of being. And so, that's I don't know what helps you kind of move forward, but that's what I
Yeah,
have
no,
to
that
think
North
about.
Star
Yeah.
around, making lives better, creating better conditions for people to show up in their own lives and be able to have access to those opportunities that are gonna yield the outcomes that they want personally for themselves, for their families, for their communities.
And we
Um,
have to believe it. Like, I
we have
think
to believe that that's
I only
possible.
believe it because it's happened in the past. Like,
Right.
that's for me. I only believe that that is possible because I have read, seen, witnessed it happen in the past across legacies and generations. Other than that, I don't know why I would believe it.
Mhm. Yeah. One of the things I'm compelled by is this notion of doing the work of equity coalition style. That's something I can get excited about. No one entity has all the answers. None of us in and of ourselves are gonna be able to move the needle in a way that is, as significant as we say we want as a society. So you have been behind the Rise to Health Coalition, AMA, IHI, other partners, including the AHA. Can you say a little bit more about the power of coalitions to actually sustain the work that is happening today for future generations? How do you lean into coalitions to make that happen?
Yeah, so and I thank you for the question because I'm also like really digging into making sure that when we say coalition, coalition could just mean a group of people coming together, but it's not just that. That's not how change happens. There's a context. I used to teach community organizing in health to public health students, through Meredith Minkler's book. And you mentioned it just a second ago. Anything that has produced change in any group of people have used tactics and strategies as it relates to community organizing, no matter who it is, right?
Right.
And I think that's poorly realized and understood by those who are not community organizers. Organized medicine gets it because that's what organized medicine is.
Mhm.
It's organizing,
It's
right?
yeah.
And what is organizing about? It's building power with people so that people pay attention to the power. People pay attention to power, financial power, political power, collective power, people power. That's part of the point of being organized, is to build power. And so to me, that's the nature of what a coalition at this day and age needs to be about, not just a group of organizations that come together in their individual contexts, have different ideas, but how do we build power to create and produce change? How do you build power so that people pay attention to you and you become a relevant entity, so that what you say and your influence is critical? That's the nature
Right.
of AMA and AHA, right?
Right.
There's so much power, whether it's financial
Correct.
power, political power, or financial power, I would say. And so we have a lot of influence. So people listen to us,
Yeah.
whether valid or not. I'm just saying they respond to that. Certain structures respond to that. Not everybody listens to us, though,
But
of
we're
course.
seen as relevant.
To a certain segment of people. For those are the
Correct.
people who hold power in political
Right.
spaces. And we're not seen as relevant to everyone if
Exactly.
we are not meeting their needs. So I say that the coalition, to me, the vision is like, again, the opportunity to build power, the opportunity to be in community, and the opportunity to, and you have to communicate within the context of that community. One, to learn from one another and what we can do at our individual institutions, but then ultimately, collectively, what can we do to push, to advocate, and to create changes that are structural, And so that is absolutely needed. And then there's this other word of solidarity that's also been a little bit challenged in my vocabulary, and me trying to understand what it means to be that and what it means. And there are a lot of different, there's different contexts to that. I recognize our theories around it, but the ability to be in solidarity for me means we have a similar vision and outcome, but we may not have the same like theory of change and tactics all the time. But there is a time where we need to come together for certain aspects of it to push something forward, which means sometimes we may have to let something go.
So I'm gonna give you the last word. I mean, there have been several nuggets here along the way. And so I wonder, is there any last, reflection from the piece you wrote, from just thinking about the larger societal pressures, the political environment, the space in which we find ourselves today? Any words of encouragement for your colleagues who are doing this very difficult work?
Well, if it's for my colleagues, as in DEI colleagues, then because the audience matters, right? I understand when decisions have to be made, because I also think there's a certain point in time, if you are not healthy, we have to do what's best for ourselves at the same time. I don't believe, and I say that because I think we need that as not that people are going to just jump all of a sudden, but to just have that relief and give yourself permission that that what you're experiencing is real, and you shouldn't have to necessarily suffer through it at this given time, and it's up to you at whatever point in time you want to be committed to it still, and that's fine if you want to stay. Nobody should knock anybody for their choices around how we do, or how, maybe not how we do, but if we choose to do this work or not. And then I would say, just for the larger context, there's no question that we all need to figure out how we're showing up at this moment in time.
Well, I can't thank you enough for your time spent today. It has been hopefully reflective for you and instructive for our listeners.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.